गुड मॉर्निंग एंड वेलकम टू हाई मेडिकल एकेडमी। आज का हमारा सेशन जो है, हमारे सेशन में हमारे साथ बहुत ही स्पेशल गेस्ट हैं। डॉक्टर अबिहा, वो पाकिस्तान की फ्रेश ग्रेजुएट हैं माशाल्लाह। और उसके बाद उन्होंने ज्वाइन किया है हाई मेडिकल एकेडमी का ग्लोबल मेडिक्स एनएचएस प्रोग्राम। तो आज हम उनसे सुनेंगे कि उनका एक्सपीरियंस कैसा रहा डे वन से, जब उन्होंने कांटेक्ट किया हाई मेडिकल एकेडमी के साथ, उस दिन से लेके आज तक उनका कैसा हुआ, साइन अप होने तक उनका सफ़र कैसा रहा। उसके बाद हमारे साथ हैं डॉक्टर उमर, जो एकेडमिक लीड हैं हाई मेडिकल एकेडमी के, प्लैब ट्यूटर हैं। ही इज़ बॉर्न एंड ब्रेड इन यूके, लिवरपूल मेडिकल यूनिवर्सिटी के ग्रेजुएट हैं। और ही हैज़ बीन ट्यूटर, ही इज़ बीन मेंटर फॉर नर्सेज, डॉक्टर्स, जूनियर डॉक्टर्स, फार्मासिस्ट। तो उसके बाद हम उनसे सुनेंगे कि वो हमारे कैंडिडेट डॉक्टर अबिया हैं, पाकिस्तान के फ्रेश ग्रेजुएट हैं, उनको इस जर्नी में कैसे हेल्प करेंगे। सो वेलकम डॉक्टर अबिया, कैसी हैं आप?
थैंक यू डॉक्टर। I'm good, अल्हम्दुलिल्लाह। आप
जी
कैसे हैं?
अल्हम्दुलिल्लाह। सो जी
I'm
बताएं
good,
आपका
अल्हम्दुलिल्लाह।
कैसे रहा, आपने कैसे हाइप को कैसे कांटेक्ट किया, फिर आपकी क्या कन्वर्सेशन हुई। आई बिलीव कि उसके बाद आपका जो है ना, आपके फादर की भी डिस्कशन हुई थी कपल ऑफ। सो आप जरा ये सारा अपने अल्फाज में बताएं कि आपका ये जर्नी कैसा रहा और कैसे आप हाइप में आए।
जी, मुझे बाबा के फ्रेंड से उन्होंने रेकमेंड किया था हाइव एकेडमी का, एंड बाबा के थ्रू ही मुझे डॉक्टर शकील से कांटेक्ट करने का लाइक हुआ है। और एक्सपीरियंस फुल कोऑपरेटिव और सेटिस्फाइड था। इसमें लाइक जो क्वेश्चंस थे एट द स्पॉट मुझे आंसर्स उसके मिल रहे थे, लिंक्स भी डॉक्टर शेयर कर रहे थे, एंड जो भी ग्रुप्स थे मुझे लिंक्स सेंड किए जा रहे थे कि उस पर लाइक ऐड हो जाए, और मैं उस पर अकॉर्डिंगली मैं ऐड हो रही थी उस पर साथ साथ ही। It was so satisfied and cooperative experience in short.
तो आपकी जितनी भी वरीज थी या क्वेश्चन थे, आंसर थे, वो सारे उन्होंने आंसर किए, आपको सारे आंसर मिल गए थे?
I was having like tons of questions before joining this and talking to Dr. Shakir, because I'm the fresh graduate. I was literally running there was like sort of blank space in my mind, like how to contact and to whom I will join when I will be going back to UK. But now I have got all my queries answered, and now I'm satisfied.
दैट्स वेरी गुड, दैट्स वेरी गुड। और उसके बाद मुझे बताएं, ऑब्वियसली एक कंसर्न होता है कि स्पेशली जो फीमेल डॉक्टर्स होती हैं अब्रॉड आ रही होती हैं करने के लिए, तो उनके पेरेंट्स को भी कंसर्न होता है। तो मुझे पता है कि आपके फादर भी काफ़ी कंसर्न थे, उनकी भी 3-4 दफ़ा डिस्कशन हुई है। तो बताएं उनका क्या रिस्पांस था, कि वो रीअश्योर्ड थे, हैप्पी थे, सेटिस्फाइड थे इस बारे में?
स्टार्टिंग पे तो थे, क्योंकि उन्हें भी लाइक इतना नहीं पता कि मेडिकल में इतना नहीं है घर पे। आई एम द फर्स्ट वन इन द मेडिकल फील्ड, दैट्स व्हाई। अब वो सेटिस्फाइड है अल्हम्दुलिल्लाह। लाइक अब वो कह रहे थे कि लाइक आप कांटेक्ट भी कर लो, उनके थ्रू ही मैंने किया है, सब उन्होंने ही बताया, उन्होंने गाइड किया, और मैं कर रही हूँ।
एक्सीलेंट, माशाल्लाह माशाल्लाह, दैट्स वेरी गुड के देखें आप भी सेटिस्फाई हुई हैं और आपके
इधर
फादर।
रहता भी ही सुपर सेटिस्फाइड माशाल्लाह।
गुड गुड गुड। तो अभी मैं
फादर का
डॉक्टर
सेटिस्फाइड होना जरूरी है।
माशाल्लाह माशाल्लाह, दैट्स गुड दैट्स गुड दैट्स गुड। तो अभी मैं डॉक्टर उमर, आई विल हैंड ओवर टू डॉक्टर उमर। वो हमारे एकेडमिक लीड हैं,
ओके।
प्लैब ट्यूटर भी हैं। तो उनकी आपके साथ कन्वर्सेशन होगी कि वो कैसे आपको स्टेप बाय स्टेप आपका जो जर्नी है पाकिस्तान से यहाँ तक, उसमें से कैसे आपको हर स्टेप पे उसकी आपको गाइड करेंगे, सपोर्ट करेंगे, और मेक श्योर कि आपके एग्जाम भी पास हो, आपको जॉब भी मिले। और उसके अलावा एंड पे हम आपके और भी कोई क्वेश्चन हुए उनका आंसर भी करेंगे, और आप रिकमेंडेशन लेंगे कि आप जो हमारे पाकिस्तान के फ्रेश ग्रेजुएट्स हैं या डॉक्टर हैं जिन्होंने यूके में आना है, अपना करियर बनाना है यहाँ पे, तो उनके लिए क्या किया जाए। तो अब टू यू डॉक्टर उमर।
Thank you, Dr. Shil. Assalamu alaikum, Dr. Ume Abiha. How are you?
I'm good. आप कैसे हैं? How are you?
Ji, Alhamdulillah, I'm very well, thank you. So, a very warm welcome to you to Hive Medical Academy and to the Global Medics NHS program. We're very excited to be able to help you and guide you and hopefully facilitate your journey to the UK in a smooth way and in a way that you will be pleased with. Um, so please, if you could just tell me a little bit about yourself, where you're from, where did you graduate from, and when, and then we will have a conversation about your experiences, any concerns. I will take you through the program in detail, explain what's going to happen, and hopefully it will be the first of many conversations, but it will just be an introduction for you, hopefully.
Basically, I'm a final year medical student from Hive Medical and Dental College. I'm resident of Lahore, and I am waiting for my practicals, and they're about to start, and 4 are left. And after that, I'll be starting my classes. And the last day for the practical is 16th of April, and after that, I'll be going back to UK, inshallah. and they will be my first day in academy. So before that,
Okay,
I'll be having online conversation and online meetings here. If in
sure,
case you
sure.
start some sort of course, so I'll be joining you online before 16th.
Okay, excellent. So so your final year and you just about to do your final exams, is that correct? You're just about to do the final set?
Yes, I have just gone through the written examination. Yes, a written
Okay,
examination. I'm left with my practicals and 4 hour lab. So I'll be free from my practicals after 16th, on 16th or maybe on 17th of April. Then
okay.
on 21st of April, I'll be in UK, inshallah. And I'll be joining this academy.
Okay, excellent. That's fantastic. So the fact that you're a fresh graduate, that's brilliant. That's perfect for the NHS program,
Yes,
and it's perfect for the PLAB exams. The good thing is that your all your knowledge and all the things that you've learned over the last couple of years, especially in terms of clinical medicine, will all be really fresh. That will help you, and it will help us as well in being able to prepare you well for these exams. So I'm sure you know a little bit already
yes,
about the journey and the pathway, but I'm just going to explain very briefly, just for the benefit of anyone who watches, and of course for yourself as well. What are the actual steps that we will need to take and to take you through over the coming year or so to hopefully bring you to an NHS job. So first of all, obviously, is your medical degree. You're very close to achieving that. And once that is in your hand, that will be a great day for you. It'll be a great day for your family. It'll be a very happy day. I still remember that day for myself like it was yesterday, even though it was a very,
yes,
very long time ago. But it will be one of the happiest days of your life, and we'll be very happy to share that with you because you're going through that journey at this time. After you've
yes.
achieved that, then our focus will shift towards the OET and the PLAB 1 exam. Now, you can do either the IELTS or the OET, but as I'm sure Dr. Shkil has explained,
Yeah.
it's much more appropriate for you to sit the OET. It's more suited towards healthcare professionals, and the content and the training is more appropriate for what you're going to encounter, not just in the examination, but further on in real clinical life as well. And because things are really fresh for you, and because things are, you've only recently done everything, you'll have just come out of exams, it will make sense to start preparing, if you are able to, if you have the time, for both OET and PLAB 1 kind of cautiously at the same time. And of course, we'll go through that in some detail over the coming weeks. We'll discuss we'll go through an overview of the syllabus. We'll show you our resources. I'm not sure if you've had access to the learning management system yet or not, if you've had a chance to have a look at things, but we'll discuss in detail the resources, what are the different things available, how you should use them, at what times you should do what and in what quantity, etc. It'll be very, very detailed. It'll be very, very personalized. And depending on when
Okay.
we manage to book the date for your OET and your PLAB 1 exam, we can then give you a planner which will detail for you exactly if you need, because obviously, there's one thing that doctors are very good at, and that's sitting exams. So we know you're very good at sitting and passing exams. So we're not here to teach you how to do that, but we're here to guide you because this is slightly different to what you've done already. So the planner will be available for you to help break things down and give you a bit of structure if that will be if that will be useful for you. Then once you've prepared for your OET, which will take about 4 weeks or so, 4 or 5 weeks. Once you've done that, then you can shift your focus in more detail to the PLAB 1, and hopefully then you will get a PLAB 1 date, and we'll know exactly how long you have to prepare for that. And every step of the way, we will be with you. We'll be available. Lots of our students they contact me all of the time, even about questions, about certain concepts, about things they don't understand, explanations, etc. And we deal with them on a daily and a weekly basis to explain what's going on. In addition to that kind of personalized support, you will also have 3 live PLAB 1 classes where we will cover certain areas of the curriculum which we feel and which we've kind of come to realize over many, many years of doing this, that international medical graduates will struggle a bit more with these areas because they are either less prevalent in Pakistan and other countries, or they are less kind of common practice. So things like, although for recent graduates, it's becoming less of an issue because these things are more and more involved in the curriculum now. But things like ethics, palliative care, and these kind of things. So the classes will cover these more difficult areas, as well as things like exam technique and giving you an opportunity to bring up and for us to explain in detail certain things that you are having issues with or struggling with. So that will then bring us towards the end of the PLAB 1 journey. You will sit your exam. We're sure you'll do fantastically well. All our students do really, really well. And they really enjoy, in particular, our mock exams, which many students have told us now when they come out of the exam, they find it difficult to tell whether they were sitting a Hive mock or whether they were sitting the PLAB exam. So they're very, very close. So I'm sure you'll do very well. You'll have good experience and good success in PLAB 1. Then after that, you can start to prepare for the PLAB 2. And of course, there's lots and lots of things that we'll need to discuss in the meantime, including, at that time, including things like your visa application, your EPIC verification, and all of these kind of things, when to do what, and we'll time it very well so that you can start your PLAB 1 preparation with our online part of the course, which also has videos, audios, several hundred, if not almost 1,000 cases in terms of things for you to study, to get familiar with guidelines, and to get familiar with explanations and how we do things in UK medical practice. So you'll be able to do all of that before you even come to the UK and before you do our face-to-face 10-day course, where, of course, when you do that, when you arrive in the UK, as well as picking you up from the airport, arranging a SIM card for you, arranging 10 days accommodation for you for when you're going to do the PLAB 2 course with us, the face-to-face course, as well as doing all of them things. We'll be taking you through lots and lots of teaching and practice and mock
My family
exams.
is also there in UK.
Excellent. Okay, that's fine. Not an issue. That's even better for you because you will feel much more comfortable and much more supported. So we'll be able to focus much more on the examination preparation side of things. You'll have less worry about, getting, being feeling kind of, a bit strange in a new place. You'll have your focus will be more towards the PLAB 2, which is better. So you'll have 10 days of an intense preparation in the academy face to face, with unlimited practice time as well. Obviously, you'll be with other doctors, and you'll have personalized teaching and tutoring from myself and Dr. Shakil. So it's not people who have just passed PLAB 2 or people like yourself who've just come to the UK. It's ourselves who've worked in the NHS for many years. We've got lots of experience of teaching, training. Personally, myself as well, I examined OSCEs for almost 10 years. So you'll get personalized teaching from us. You'll get live feedback. And these are the things that really make a difference when it comes to preparation for PLAB 2. Then you will sit your PLAB 2 exam. You will pass that first time, inshallah, hopefully. And then straight away after that, you will hopefully have 3 or 4 months of your PLAB 2 visa left, and in which time we will be focused immediately towards securing a job. So you'll have a clinical attachment that's guaranteed with the NHS program. We will also help you optimize your CV. We will create a job profile. We will do some mock interviews with you. We will tell you all about working in the NHS. You'll get a full induction, and over them 2 or 3 months, hopefully we'll secure that first job for you, and then that will be the beginning of what I'm sure will be a wonderful career in the NHS for you. So I said it was going to be brief. It actually ended up being quite detailed, but I thought it would be good for you also and for anyone watching to hear that. So that's a quick kind of explanation of what's going to happen. So I just want to give you the opportunity to ask any questions, raise any concerns, speak about any worries. Please go ahead. Myself and Dr. Shakil are here to answer them.
When I'm supposed to start my OET classes and also for PLABs 1?
By Monday, next week.
Like when I'm supposed to get my OET and start my classes also?
Next week.
Next week?
You're starting next
Monday.
week.
Isn't
Yeah,
it
you'll
too
get
early?
proper schedule. You'll
Isn't it
get
too
proper
early,
schedule. You'll have
doctor?
meeting with the tutor, and then you'll have proper schedule for OET, and we'll target to pass your OET within 8 weeks. But at the same time, because you have got access to our
Within
LMS,
8 weeks.
yeah, you have got access to our LMS, so you have got access to
Okay.
all PLAB questions. So at the same time, I would say just start looking into it, start doing some questions, watch some videos. I shared the links of videos, and you have got loads of videos on LMS. You have got 24 videos, you have got audios, you have got flashcards, you have got 5,000 MCQs, you have got category-wise MCQs, you have got 10 mock tests. So while you're waiting, just familiarize yourself with the system, with the content and everything. But we are here 24/7. Anything, any questions, any issue, just drop us a text. We are just a text away. And once you are here in the UK, obviously we'll meet up as well. You can come down into our office and meet up. But we will hold your hand till you pass your exam and get your job. So nothing to worry.
So after April, so this is the interval of 8 weeks for just OET, or are you just sending me the material for PLABs part 1 also?
The credentials you have got, did you try to log in or not yet?
I tried. No, I didn't.
All right. So you need to
Because
log into the
I
system.
have
Yeah.
my rotations within hospital. I have my rotations with hospital, so I was waiting for the meeting. After the meeting, once it ended, I started.
No issues, no issue. Whenever you get the time, you log in and you have got everything. So OET classes will be discussed.
Okay.
That will be separate. This is access to the PLAB course. Everything you have got access.
Okay.
So once you log in
Okay.
and just familiarize yourself. If any issues, just drop us a text. We're available all the time.
Okay.
So as I said,
Thank you,
Dr.
doctor.
Abiha, initially your first priority will be OET because obviously you have to pass that before, actually being able to book your PLAB. But what you can do in the meantime is you can have a look at the resources in the PLAB 1 online course. You can go through, a few things. You can get an idea about what the curriculum covers. It will be quite similar, I expect, to things you have done in the last 1 or 2 years. Obviously, there'll be differences in terms of drugs and guidelines and ways of doing things, but the medicine itself is the same. So it will hopefully be familiar, but you can get an idea of what things are in there, the different resources. And once you're ready, we can have another detailed meeting. And once things get started with your OET, and once you get moving with that and you feel ready to maybe give a bit of time to PLAB 1 as well, then no problem. We can have another meeting. We can go through things in detail. We'll sort out that planner for you, and that will give you a bit more structure and explain kind of how to make a start and how to get things going.
Yeah. So any other questions, Dr. Abiha? So what are your recommendations based on your experience? Based on your experience with Hive Medical Academy, what you recommend to all the fresh doctors from the Pakistan or the doctors who want to come to UK? What's your recommendation?
I recommend most of the students should get experience with the Hive Medical Academy. It's because that in Pakistan there is having a lot of lack of awareness. Basically, no one mostly shares the shares the material, or if someone is preparing, no one will be discussing it or sharing it to you. And it's like completely confidential if someone is preparing for it. When we just came to know after, if once someone has appeared in the PLABs or OET, okay, you have just done it, you have just appeared in the exams. We're completely just lacking awareness in Pakistan mostly. But as far as I should find that students should also join this academy, regardless of any kind of uncertainties. But part of like you're being creative and satisfied, and you're just to the point and just 24 by 7 services. I'm doing it, and I'm just having all my queries done. So it's basically students should join us.
That sounds good. Definitely, if they want a beautiful career in the NHS, because there's so many benefits. Because I myself, an international medical graduate, I graduated from ISTA, then I did PLAB journey, came here, I completed all my training from junior doctor to consultant. So, we could guide them far better way from day one till they get the job in NHS. So we wish you all the
Hopefully,
best.
hope-
As I said, we
thank
will be
you.
with you all the time. Anything, any worries, just drop us a text anytime. We will sort out.
This is a good thing of this academy. Thank you.
No, thank you. And thank you so much, Dr. Umar, for such a detailed discussion and answering all the questions about the Global Medics NHS program. And thank you so much, Dr. Abiha, and we'll see you soon, inshallah. Thank you.
Thank you.
you,
Thank you.
Dr.
Nice to meet you, Dr. Abiha. We'll have a detailed meeting
Thank
soon
you.
once
Nice
things get moving.
to meet you all.
Okay.
Thank
Bye-bye.
you.
Bye-bye.
Take care. Bye.